This is for December 2nd, and let me go to the next. This is a program for COVID-19 Free Cambria, and so far, we're pretty good position, and it's a viral illness that spreads from person to person. That's a fact, and each one of us take responsibility of preventing and keeping a control on this spread by observing preventive cautious measures recommended by CDC. So few of them are don't go out in public if you're sick, wear a mask if have symptoms. And you very well know by now all the symptoms, which is dry cough, fever, sore throat, body aches and pains. And then you're supposed to wash your hands frequently, especially if you have been out in the public places and touching various items where people have more frequency of visiting. And these are the numbers. This is as of today, worldwide 64 million and over, 1.5 million deaths. USA 14 millions and 277,000 deaths. So this shows about 1 million people getting sick every 6 days in the past 2 weeks. So that is a huge number. In Wisconsin, as of now, is 391,000 people who are infected and 3,400 deaths. And about 300-400 deaths are more than the last presentation. Columbia County, we have 3,500 people confirmed with COVID-19, and the deaths are 12. You see, when we started the program, there were 5 or 6 deaths, so it's doubled already in the past 8 weeks. And let's go to the next slide. These are US numbers, and so as of March 18th, 7,300, December 2nd, over 14 millions. Deaths March 18, 116, and the deaths now are 277,000 and over. So I'll go a little bit in detail on the reasons why we have more deaths. And let's go to the next slide. This will show you, this is from New York Times, update today. The cases, as I said, there's increase of 2% in last 14 days. Deaths are, I think, 31% up. And hospitalization is 32% up. So now the hospitals are running out of capacity. They are having difficulty accommodating more serious patients in ICUs. They are running short on respirators and infectious diseases specialists, and even the nursing care. And that's the reason the death rate is high as well. And here we have nursing homes. As of October 25th, there was shortage of personal, protective equipment, which is gowns, masks, gloves, and the shields and all kind of things required to prevent the spread of the virus or catching it. And so there is a shortage in Wisconsin, 30%, but generalized shortage in other states is 25%. So we are lacking a little bit of getting the supplies. And there's a shortage of nursing staff, about 25%. And that resulted from either the staff members were exhausted or they were sick, or they didn't have the full capacity in the beginning of the pandemic. All the nursing homes had reported testing for COVID-19 their residents. But on the staff is a different story. Uh, about 12% of the nursing home did not check their staff. So there is a flaw there, because if the staff was symptomatic or asymptomatic spreader, then you did not really trace the cause of spread of infection in the nursing homes. US death rate is higher than any other country. Australia is lower, Japan, even India, Germany, France, and I think they contributed this uh, to weak public health infrastructure. That means the communication, the availability of the information in timely manner, the availability of the protective equipment, availability of the testing facilities, and the treatments. So the poor pandemic response, initially, it was thought to be that it will go away, and is not as much as you went with the politics behind it. Actually, the virus doesn't care who's Republican, who's Democrat, is going to get everybody, and that's what happened. And US patients had more morbidities. So that means they were sicker with other diseases. Either they were older, or if they were young, they had other illnesses, which made them more vulnerable to get into respiratory failure and heart failure and kidney failure when they got pneumonia from the COVID-19. This is people travel during Thanksgiving should get tested, because if they travel by air, it's possible that they got exposed to someone. So there is an increased risk of being exposed to the infection. There is a the need to decrease the unnecessary activities for about a week. I will go into this time period, 14 days or 5 days or 7 days in a little bit. But they should not go unnecessarily outside for about a week after travel. Get tested in 3 or 5 days after travel. So that is important to get the screening so that you'll know that you didn't get exposed. And though you are asymptomatic, don't have cough, don't have fever, don't have headache, but you were traveling and came in contact for more than 15 minutes to anybody, then you should get a test. Not recommended to have a quarantine after travel unless you had a direct exposure to a person with COVID for 15 minutes in close contact. That means within 6 feet of distance. And it has to be 15 minutes cumulative. If you were 5 minutes here, 10 minutes there with 2 people who could be positive, then it counts 15 minutes exposure. So this is a general rule, but individually you have to see how you feel, and if the test facility is available, and if you're going to be going to work or moving out of the house. So this is the recommendation. This is a case presentation to me last week from Beaver Dam. The question was when to return to work. And it's a young male. He had chills and body aches and leg pains with a dry cough for about 3 days. Then the body aches and leg pains and chills diminished. Cough was more or less gone. There was no fever. And 5 days after above symptoms, the PCR test for COVID-19 was positive. So 8 to 10 days after diagnosis, he started having fatigue, fidgety, and restless legs. He was not able to sleep at night, became very anxious and short-tempered and very weak and unable to do chores at home. And now he started developing some confusion and it comes and goes. So the question was whether he should return to work. Obviously, he had a positive PCR. He had short-term symptoms. Then he developed long-term symptoms. Whether the infection is been reinfected or he got lingering on complications from the virus, and those complications can make him confused. So he will not return to work. He will have to have a titer done to see the antibodies, and also a good idea to get the PCR repeated. But return to work, I would suggest minimum 14 to 21 days in this case, because he had complications. So that will be, the recommendation on this case. And of course, the presenting symptoms are cough, fever, weakness, fatigue, and headache. The less common are nausea, vomiting, loose bowels, congestion, rash, and loss of taste and smell. This is CDC update. As of today, they're changing the guidelines for quarantine. And I'll explain that what this was based upon. And may shorten quarantine from 14 days to 7 days if test is negative, or 10 days if there was no test done. So if the PCR or rapid test is negative, the quarantine is 7 days. And if there is no test done, and then it's 10 days. And there is a new distribution of vaccine which has been planned. Federal pharmacies are partnership with the program. So there will be local pharmacies like CVS and Walgreens and others, and other pharmacies in the hospitals. They will partner in distribution and giving the vaccine. So FDA Independent Vaccine Advisory Panel meets on December 10th to review the data that is submitted by two companies. The one submission was November 20th, and the latest was November 30th. So they are both under consideration. And if they want approval by FDA, they will need to have independent scrutiny and looking at the data, how effective and what are the complications and things like that. So that's in the process. And by December 10th, if they approve it, then December 11th, we will have the vaccine available in the pharmacies. France has reduced the quarantine from 14 days to 7 days, and Germany is considering 5 days. So this is something on the horizon. Now, vaccine will keep you safe only for a year, that's likely, because you will have to have another shot in a year, because the immunity gained by that is not tested long enough, whether it will work 2 years or 5 years, because disease has not been there for that long. So earliest cases reported in the United States were in December, and real first case was noted in March. And the people from December to March didn't get tested, and there was widespread of population who had fever, cough, headaches, and so they never knew that they had COVID. And if the disease has not been there that long, then it is hard to see that how effective the vaccine uh, antibodies will stay. Now we know from the infection, the people who get infected, antibodies in their blood is about 90 days. Then they go down or disappear. Unless they had a secondary infection, which is very rare, then if it's a mutation in the virus, different virus, then they will get longer, blood test antibodies. And children, this has not been tested under 12. So next, uh, vaccine test will be the children and pregnancy. So that will be coming end of next year. Battle for accuracy. I mean, everybody has doubts in their mind, and whether to go and get the shot or not. Is it going to work or not? We're not talking about the people who never believed in any vaccine. So they perhaps will be still not in favor of this, but there has been so much fake information, news, that people, they became very doubtful and uncertain, and they're not trusting the information. And there's also misinformation. And AstraZeneca, who developed vaccine in England, half strength injection, which produced better results than the full strength injection of the vaccine. So when that report came, and the initial report was 70% effective, and then few days later, 90% effective. So people got, suspicious of that report. So that was sort of lack of trust on the information, and that created doubt, and that will bring the acceptance of the vaccine a little bit lower. And V-Safe by the government is an agency type. They will be have an active reporting system for side effects of the vaccine. So far we know that the major side effect, which has been declared so far, is pain at the site of injection, which is nothing unusual. And second is the fever. Now, fever is due to immune system response. So they haven't come up with the recommendation whether to use Tylenol before the injection. But they may come with that you take a couple of Tylenol tablets, and so that you don't develop fever. Ibuprofen is not recommended because it's metabolized in the liver, and there is some more complications noted with that. So that has been out. This is a viral shedding graph on the left, and we're talking about the live or viable virus, which spreads the infection. It's not dead virus like on the surface of the objects. So there have been studies, and they looked at it, On the left, the pre-infection period, which is green and positive by PCR. Then there is a 3 to 8 days of infectious period. And then after 7 to about 12, 14 days post-infection period, but PCR is still positive. So virus goes very high peak, then it comes down. There are several studies, and no study detected live virus beyond 9 days of illness. And this is from the lungs and upper and lower respiratory tract. And they collected the specimen, they studied it, and it was not live virus beyond 9 days. So a viral peak is seen in the first week of illness. You can see that from the curve going up is 3 days to 7 days. So that's about the time the person is most infectious. And this is the reason they cut down the isolation period. It's from 14 days to 10 days or 7 days. And even in Germany, they are thinking about 5 days. Another reason behind that is 14 days is too long to keep people out of work, and 5 days is more reasonable. If there is no shedding of the live virus, infective virus, then there is no need to quarantine them for that long. So this will be coming, there will be more studies on that in the next couple of weeks. So when I have next week presentation, we'll catch up on that if there is something new. And the question was also asked that what does 95% efficacy means? They say this vaccine is 90%, this vaccine is 95%, or both vaccines are 97% effective. So it does not mean that 100 vaccine recipients, people who received vaccine, 100 of them, that 95 will be protected from COVID-19 disease. It doesn't mean that. And efficacy is determined in clinical trial is difference between number of sick people in placebo group and number of sick people in vaccine recipient group. There are two groups. One received the placebo, means nothing, or saline, and vaccine means the real vaccine, they got it. So if there is no difference in the infection, efficacy is 0. If no infection in vaccine group only, efficacy is 100%. That means the people who received vaccine are protected 100% because no one got sick in that group. So efficacy of the vaccine is 100%. And if there was placebo group, if there is no difference, then efficacy has to be 0 because they didn't do any better than people who received the vaccine. So effectiveness is how well vaccine performs in the real world. So now in the next 2-3 weeks, we will have about 20 million people injected with the vaccine. That will be our test for effectiveness and any complication. So that yet to be seen. So I see a lot of information will come in the coming weeks. Vaccine priorities, it should be decided today, should have come out, and otherwise it will be tomorrow. And healthcare workers are the first priorities. So people working in the frontline emergency room and the ambulances and patient transport who are handling the patient. 21 million people are there. And residents and staff of long-term care facilities, there are 3 million. You can see that there are 24 million people on the first phase 1, but there are only 40 million doses, and each dose has to be repeated twice. So only 20 million people will get the vaccine in the coming 2 weeks. By the end of the month, we will have more. Then the next month, in January, we may have like a billion doses. So they'll be available in phase 2 to the rest of the people. And this is phase 1. And here is the phase 2, or who is next in line: essential workers. And essential workers are about 87 million. That includes police, the fire people, the educator, the teacher, utilities, water facilities, people who work there, food service, and agriculture, restaurants, transportation, all the car drivers and buses and trucks and all that. And the last group there is people who are over 65 and have comorbidities. That means they have other illnesses. If they got pneumonia, so they may get complication, kidney disease, diabetes, high blood pressure, asthma, that will all be included in the second phase. Next slide. A very simple thing. Don't go to the crowded bars, and unless it's outside, 6 foot apart, no shouting, wear the mask, and that's okay. Restaurants have to be outside, but in the winter, I don't think it's a good idea to go inside unless they have air circulation control and restrictive, quarantine for their people who've been positive. Don't let them back to work, and washing hands and things like that. Flying by air, though the flying is being continued, and they are observing no middle seat passengers. The capacity is only 25% currently, but is going to pick up after the vaccine. And but if you're flying, best thing is to keep your distance at the check-in, check-out, and sit far apart for other passengers. Don't use the facilities there. If you have to, you've got to be careful. Washing hands and not touching the knobs and things like that. And do not travel by crowded bus or a subway. We don't have subway here, but New Yorkers have it, and so Boston and other cities. So I think I'm reaching the last slide. Yes, this is our test sites remain the same, and so we can answer question.
I have a question about the vaccine. Who is going to decide for the state of Wisconsin what vaccine we're going to be getting available to us? Like, is the governor making a deal with the pharmaceutical, or is like the medical society getting involved?
Okay, medical society has only recommendations, but not control. Department of Public Health under governor and health secretary has the power. The federal government is contacting the retail pharmacies, and they may have direct contract with them for distribution. But how many vaccines are given to the state is decided by federal government, and how it is distributed, that's decided by the state government. And I think there are 4 states who are getting the vaccine first. One is California, second is Wisconsin, third is Utah, and there's one more. Administration will be in the public places, doctor office, and pharmacies. And it will be free of cost. And some have just walk in like a flu shot. So you go in and register and get a shot, and then go back in 28 days to get the second shot. And you don't have to get the shot if you have fever or other illness or some other problem. Then you have to check with your doctor. It will be just like a flu shot. And the complication.
I wondered about who was determining if we're getting it from Pfizer or from.
Oh, whoever is able to sign a contract.
But when do they think that it will be that 90% of the United States will be all vaccinated?
They think mid-summer. Early summer, there will be another maybe 87 million people will be injected. But to give the injection so many people, and 2 injection is quite a task. And so how they're going to manage the registry, how they're going to, who's going to give it, the nursing staff or doctors or technicians, we don't know. So it's all in the works. I think they are running short on health people to help, but I'm sure they're recalling. In Wisconsin, they have recalled all the physician nurses who have been retired, so they're renewing their license without any fees. And other states across America, they have given them opportunity to practice anywhere with the open license. So if you have a license in one state, you can see patients from any state. So they're trying to control it. I think the new the committee or the advisory committee on COVID-19 with Biden is already working on it. At least 20 million people will be vaccinated.
Will each individual hospital make their own regulations as to whether it's mandatory or not to their workers?
It will be like a flu shot. At this current time, if I'm working in a hospital, I have to have a flu shot. Otherwise, it gets recorded that you refused on what grounds. It's a mandatory requirement for employees to have a flu shot. I'm sure COVID is more serious than that. So it will be mandatory in the healthcare facility.
I just kind of wondered how that was going to work if you have people that are kind of reluctant to take, you know what I mean?
Yes, there are. And I'm sure there will be some exclusions, but not general,
Mm-hmm. It's, you hear so much stuff sometimes, I mean, from changing the channel on your TV. You hear such different things, you don't know sometimes what the truth is. That's why I like these meetings, because I believe you do your research. And
well, what I try to do is get the latest, and most of the material comes from infectious disease. And so I will on New York Times and State Department and CDC and FDA and other foreign agencies, they contribute to this information. Next week, we'll look forward to that.
That sounds good. Appreciate it.
Yes, yes. I'm so glad that you are all in attendance, and I'm happy. And I will make sure that I get you the information in timely manner. And even if one person is saved from not getting an infection, I think our purpose is achieved.
Appreciated that. You've been putting a lot of work into it. I appreciate it.
Well, that's why I retired to work on it.
Work harder?
Joanne, we didn't have much work, right?
No, not at all. I didn't.
But
I
Joanne,
was waiting.
I tell
I
you,
was waiting
Joanne
for him to
has
say he
been
was coming
help.
out of retirement.
Joanne has been a lot of help, always. And I wish her the best health and long life.